RMD. Um, so the word is out. IR can be very unsatisfying as an attending. I got to give Covey props for putting this out there. I do want to say a couple things about this article, which basically describes IR and all the frustrations of being an IR attending. The first thing I think that's relevant is that I think Covey did it pretty nicely, but he's certainly not the first. I want to say 2 or 3 years ago, I saw a very similar post. It was a shorter post. It was in the SIR forums, and it was by a Dr. S. And it was actually titled, a very nice title. It was called The Elephant in the Room. And it was basically describing that IR practice as an attending is one of the most frustrating things to experience. And this is in contrast to the training. The training of an IR is actually pretty fun. The training is actually nice, For 4 years, you do diagnostic radiology, which is an 8 to 5 job, a nice 8 to 5 job, a white-collar job. You then transition into a fellowship, which is probably a brutal fellowship, probably you're working 15-hour days, but you do that 1 year of fellowship. You do like 1,500 plus cases. Every day you are just doing cases. You get really good at doing procedures, and it's fun. You do a lot of high-level, intense, complicated procedures. You feel very good about yourself after that year. The practice of IR is tough, It's tough because the things that you're trained to do, you may not be doing right away. And the things that you're used to as a fellow or as a resident, you're just not going to see out there. And the reasons are numerous. Like I said, I just wanted to say that although I think Covey outlined it pretty nicely recently here, I think it deserves to be said that this is a recurring theme. This is a cycle. The post by Dr. S came out a couple years ago. That sentiment died down, and that sentiment reemerges. And it's going to continue to reemerge, I think. At the crux of this issue with IR is the fact that, whether you want to ignore it or not, again, my elephant in the room is that we are radiologists. That's it, point blank. We are radiologists. Until that changes, and I don't think it will ever change, but until that changes, there will always be this frustration because you're basically trying to be something that you really are not. There are those of us in this specialty that want to change the name of IR. And my question or my response to that is always, what are you going to change the name to? You're a radiologist that does procedures. You're an interventional radiologist. There's nothing else that you could ever say that you are. Some people go ahead and say, I want to be called a surgeon. And to that, my response is, how could you say you're a surgeon when nothing about your training tells me that you're a surgeon? You didn't spend time in the ORs. You didn't train as a surgeon. You didn't do a surgical residency. You're not a surgeon. You're a radiologist. And that's really the crux of this whole thing. You're a radiologist and you're sort of pretending at times not to be one, and that creates the problem, If you're one thing and you keep trying to tell yourself that you're not that thing, again, you have a right to do that. You have a right to interpret yourself whatever way you want to interpret yourself, but you got to understand that does create problems. That creates a dissonance internally. And that is exactly what we're seeing in Covey's article. What do we do to go forward? I don't have a magic bullet for this one. The only thing I can come up with after thinking about it for a few days is that you can't expect IR to solve all your problems. You can't expect a career in IR to be satisfying, to complete you, to finish you, and make you whole. It's never going to do that. It's always going to leave some part of you wanting more. And you could say that about IR. You could say that about a career in medicine. You could say that about a high-paying job, a high-paying career. If you think making $500,000 practicing medicine is going to make you fulfilled, my response to that is, for how long? For how long will that sustain you? Until what point are you going to want something even more than that? Not necessarily compensation, but just something intrinsically more. At what point is your lifestyle going to accurately reflect how you feel internally about yourself and your skills? It's hard to say that you'll ever reach that point where you're satisfied. IR can be frustrating as a attending. I don't know if it's more frustrating than other fields. I do know that it's a recurring theme within IR for this to keep coming up. Bottom line, I have learned to not expect the world from my career. That's not what gives me meaning and purpose. You got to find it somewhere else, somewhere outside of IR, somewhere outside of radiology. You've got to find a meaning and purpose that's a little bit deeper than that and pursue that. And IR, again, is a way to survive. It's certainly a good way to get by. Diagnostic radiology is a good thing to do in the downtime. It allows you to earn a comfortable income and not necessarily have to be in the hospital. So I'll leave you with those thoughts. Props to Covey, props to Dr. S for putting it out there a couple years ago. And let's see where this conversation goes. Stroke RMD.